My name is Dr. Julie TwoMoon. I'm a naturopathic medical doctor and an acupuncturist with a practice in Plymouth, Michigan called Seven Directions Center for Restorative Medicine. This video is about migraines. Now, the first thing we need to establish is migraines aren't normal. Migraines are an inflammatory response out of control in the body on a cyclical variance that can relate sometimes to hormones, but more than often it just relates to globalized chronic inflammation. You can solve migraines for most people by simply identifying what that inflammatory pattern is and making necessary changes. Sadly, migraines are so common that people think nothing of them. I can't count the number of times I've had patients in my office talking about their migraines and sort of, rather off the cuff saying, I had 2 migraines last week. And they just pass it off. They take their Imitrex and they take their Excedrin migraine and they move on. But migraines are not normal. If you're having consistent pain in your body is giving you a warning signal. I think of these as, flashing neon lights. Your body has found a way to throw up a big neon light to say there's a problem in our system that needs to be dealt with. Please help. Now I know that more and more people are seeing migraines even developing in very young children, in children under puberty, and then getting worse as they venture into the years after puberty and into young adulthood. And this is extremely concerning to me because the migraines are debilitating. Anyone who's ever had one knows that they can end you in the hospital. They can result in the need for morphine when they get extremely serious. And understanding why and how they're created is essential. To start, migraines are an inflammatory response, like I said, and so they usually have an origin within inflammation that results from ingestion of food. Food is the one thing we all do every day. It is the most common trigger in our life. And you have to think of it as a threshold. So we all have a threshold. It's like a line. Once you pass it, the body begins to deteriorate, to break down, to create magnified symptoms that you cannot possibly ignore. And food brings us to that threshold, but it takes a long time to get there. So a lot of people kind of dismiss the connection between foods and their migraines other than the common triggers like alcohol, red wine, chocolate, some preserved cheeses, those kind of things. Some people will say, oh, I know I can't eat that. It'll give me a migraine. Because those are foods that have such a significant trigger that they push you over the threshold quickly. But in reality, the biggest threat are from foods that you consume daily. They do not cause immediate symptoms. They in fact just create one more layer of inflammatory change that drives you further towards that threshold and makes it more likely that you can be tipped over the threshold and therefore develop a migraine. Migraines are a pattern that starts in the gut for almost every person. Even if there is significant hormonal involvement, they start in the gut. So the first place to address is what is happening with daily lifestyle habits, namely those associated with diet. Migraines are particularly responsive to removing foods that one has sensitivities to, and at the same time implementing plans to repair the gut lining and therefore restore balance. In my practice, I primarily use Sanum therapy to repair the gut along with specific classical Chinese herb formulas and sometimes Unda drainage because the terrain is very specific. It cannot be repaired by taking a probiotic and a little bit of anti-inflammatory amino acids. And anyone who tells you that it can is definitely not being truthful. Our terrain of our body is so dramatically varied and has such nuance that even taking probiotics at times can be kind of a futile habit because we exist with hundreds of strains of bacteria in our gut, and saying that taking some acidophilus or a bifidobacteria is going to be sufficient to repair gut lining when there are hundreds of possible species that have been affected is kind of a very arcane approach. Whereas addressing the fact that there is a generalized balance that must be achieved, that the mucosa itself is the home for those bacteria. And if you have a damaged mucosa, you don't even have a surface for bacteria to exist on. Your gut bacteria are the primary signalers for a lot of your nervous system functions. In fact, more of your brain processes are directed from your intestine than are directed from your brain. The brain is waiting for those signals to come to them. If those signals are aberrant, then it can only respond with aberrant information at its source. The other factor is that your gut is the primary producer for a lot of the hormonal signals that take place in the body, so it's also directing a lot of those processes. Your mucosa is meant to be rugated, and that means kind of folded. It goes like this. It's got this nice curve to it. At the end of those curves is where those bacteria live. Most people have had such chronic inflammation in their gut that they actually have a rather straight colon. There is no place for bacteria to sit. So you could take the best probiotics in the world, but if you do not address dietary factors of inflammation, you are literally flushing money down the toilet. Migraines come from the gut as one of their first and foremost causes. It is not the only cause, but they do come from the gut. You need to remove foods that you're sensitive to, and you also need to increase the quality of nutrition coming into the body. Most people mistakenly think that if they had gut inflammation, they'd have chronic diarrhea or constipation, chronic gas and bloating. That is simply not true. It is actually one of the most common conditions that there are not digestive symptoms even when there is dramatic digestive inflammation. And this is because the body adapts in different ways. We all have structures and organ systems that are more prone to problems. And if the gut is not one of your sources of weakness, as in that's where your neon arrow is going to come up, it's not going to produce symptoms. So do not mistakenly think that if you have regular bowel movements that are of normal shape and color that you have good digestion, because that's simply not true. Now, after removing foods that you're sensitive to and improving the cleanliness of the diet, other things need to be addressed. Migraines always have a connection with the hormonal system as well. The hormonal system will need to be re-regulated. If you're a woman and you're taking birth control pills, those are going to need to be discontinued. They are so very stressful on the hormonal system and on the liver. The liver is a primary organ of detoxification, but it has so much burden on it in our modern world that adding exogenous hormones that come from places like birth control pills is actually adding fuel to the fire. You may feel like it makes an improvement. Initially, you are looking at problems down the road that you can't even conceive of. Taking the birth control pills out of the picture is essential. HRT is also sometimes an issue for women with their migraines. Hormone replacement therapy can also be very stressful to the liver. Even natural hormones can be very stressful to the liver. It is more important to regulate the organs than to replace hormones from outside sources. Replacing hormones from outside sources is propping up the body, but over time it cannot fix the problem. And if your goal is to have sustainable long-term health, then just constantly replacing hormones is not an ideal approach. Your liver needs to be supported, as does your kidneys. This is where drainage can be very, very helpful. Drainage is a wonderfully gentle yet profound method of opening up the pathways of elimination and therefore allowing the body to resume its normal processes without being pushy. People with migraines, their bodies do not often respond very well to pushy therapies because it usually prompts more headaches. And that's why detoxification is a tricky issue. If you have chronic migraines, you need to be detoxified, but do not attempt a detox without being appropriately supervised by someone who understands those pathways. Because if your liver and kidneys are not capable of handling the waste that will be eliminated, you will make yourself worse, not better. Migraines are also an inflammatory condition of chronic emotional toxicity. That's something that most good practitioners should evaluate for. Very often this can be helped by flower essences, by homeopathy. Acupuncture is an indispensable tool for chronic migraines. And in fact, I've seen a lot of patients have their migraine patterns completely altered by allowing those meridian pathways to resume normal connections and creating more strength in those organ systems. Migraines are complicated. Applying a few herbs here and there is usually not the wisest of approaches. And if you apply a remedy, but as soon as you stop taking that remedy, you get your migraines back, then the remedy is not fixing the problem, it's covering it up. Not much different than taking an Excedrin migraine, a Tylenol, or an Imitrex. Might be a little bit less toxic to the liver, but over time, you need the pattern to change. The key thing to remember is migraines are not normal. You were not born with migraines. Migraines developed over a pattern of both inherited toxicity and lifestyle toxicity, that then generated a point where you are so close to your threshold on a daily basis that at any moment you can be tipped over said threshold, reducing the inflammatory processes through appropriate application of remedies and food changes, especially adopting a diet that eliminates food sensitivities for at least a period of time, if not permanently, depending on the person, restoring the mucosa and the extracellular terrain of the body using remedies that understand the complexity and not just trying to pound in high doses of nutrients and high doses of probiotics that you'll never be able to get off of, is the best treatment approach. Please remember, though, migraines are not normal. Do not accept them as normal. Do not just shrug your shoulders and say, oh, I guess I have migraines. My mom had them too. Familial patterns come from familial habits and inherited toxicity. Those are things that can be altered using well-placed remedies and therapies that open up the pathways of the body and restore balance. And you do not have to live with migraines. Migraines are not normal. My name is Dr. Julie TwoMoon. My clinic is 7 Direction Center for Restorative Medicine in Plymouth, Michigan. This has been my video, Migraines Are Not Normal.